Hi, I'm Loretta Bush, President and CEO for Authority Health. And today we're going to talk about something that I don't think we talk about nearly enough, and that's America's favorite drug, maybe the world's favorite drug, certainly one of the most acceptable drugs. Yes, I'm talking about alcohol. And the National Screening Day this year is April the 7th, and it's designed to raise awareness about alcohol abuse and alcohol dependency. It's part of the overall Alcohol Awareness Month, and it's sponsored by the National Council on Alcoholism and Drug Dependency. And today I have with me my guest who's going to help to share some light on this very important topic. It's Dr. Hassan Saghir. He is a family medicine physician, and he is also board certified in addiction medicine. Welcome, Dr. Saghir, and thank you for being my guest.
Thank you for having me.
All right. So we're going to start with the hot button issue, and that is alcohol is socially acceptable in many circles. For many adults, it's considered an acceptable beverage. My question to you is, when is enough enough and when is too much too much? What is an acceptable amount of consumption and when is it a dangerous amount of consumption?
Okay, so we have to take into account a few things. The guidelines say that men should not consume more than 2 drinks per day, and women should not consume more than 1 drink per day. So for a week, it shouldn't exceed more than 14 for a man and 7 for a woman. But if somebody was going to drink beyond that amount, they recommend against drinking more than 4 drinks per day for a man and more than 3 drinks per day for a woman. Okay. So a woman should keep it down 3 or less, and a man should keep it as 4 or less.
I got you. Now here's where it gets complicated though, because if you're saying 1 or 2 a day, do ounces come into play? So if you tell me not to have more than 2 drinks a day, but I put it in a water glass.
Right, so so it depends, absolutely, it depends on the kind of alcohol.
And the kind of alcohol.
So if it's a liquor, it's much less than if it's a beer.
Yes.
So, but between the different, like if you have a shot glass, it'll have about the same amount of alcohol as you would have in a glass of wine.
Yes.
And that would have about the same alcohol content as you would have in a beer.
Right.
So you would define that small shot glass as a drink.
Yes.
So you're drinking much more volume of beer, but that would be 1 drink, but the amount of alcohol in that 1 beer would be equivalent to what's in that shot glass.
I got you. Now, as you started to answer the question though, I heard something that I think is important. You said that even though these are recommendations, it may not mean that it's safe.
No, yeah, exactly.
Yeah, so I want you to talk about that though, because if I get the recommendation, if I hear, that as a woman, try to stick to 1, but definitely don't go more than 3. But if I'm hearing you right, but you're saying, but that doesn't mean it's necessarily safe to do that on a regular basis. So talk about that.
Yeah, that's a big important caveat. So they found that actually when you look at populations that drink versus populations that don't, if they control for all other factors, meaning socioeconomic status, overall health, they find that if you drink any level of alcohol, you have an increased incidence of cancer. So, and that's not commonly, advertised or people aren't informed about this. So even low amounts of alcohol drinking, if you look at it on a population scale, everything else controlled, you'll have an increased incidence of breast cancer in women, for example.
Okay.
What's considered low amounts of alcohol use will have a higher amount of breast cancer versus population that doesn't drink alcohol at all. And they could draw almost, show a direct correlation where you have moderate drinking will have, that much more breast cancer incidence. High amounts of drink will have
that much
more breast cancer. And
Wow.
so, and if you look at it for men, maybe it's not breast cancer, but men and women both have increased incidence of all sorts of other cancers, mostly of the upper airway and digestive tract,
Okay.
but also, so you would have increased incidence of mouth cancer, throat cancer, esophagus, stomach, colon, so even lower down, colon,
Okay.
and that whole area.
Well, Dr. Saghir, that's a bit frightening.
Yes,
I,
it
you
is.
know,
Well,
and
it
all
is.
the time I've been,
Yes.
I've been in health, I don't know that I've ever heard anyone make that correlation and that clear that just drinking, there's this relationship between that. Because usually when we talk about drinking and the dangers of drinking, I'm hearing, that when you drink too much, you may get, cirrhosis of the liver and liver cancer, and usually just associated with too much drinking. But the information that you're sharing with our listeners today is that drinking itself has a higher incidence of certain conditions.
And that's what now it's kind of making its way into the medical community, is that should we talk about this, that really, alcohol is a poison, it's toxic, and so no level is actually safe when you actually look at the evidence. So,
Okay.
but taking into account our social and cultural norms, the guidelines, the commonly agreed guidelines are 2 drinks for a man and 1 drink for a woman because of metabolism.
Wow. That's really, it's almost difficult to know where to go after that, because I wasn't even expecting you to say that. I was really expecting you to talk about the liver and the cirrhosis, but that's great information. That's what this is all about, because knowledge is indeed power. And when we know things, we can make better decisions. Absolutely. Absolutely. So, we know now that drinking alcohol in and of itself can be connected to a higher correlation between drinking alcohol and different conditions. Now, cancer, we knew that it could be associated with things like diabetes and dysfunction of other organs. But then also, excessive alcohol drinking is a condition itself, alcohol use disorder. Talk about that for our listeners, just the condition of alcohol use disorder. Let's focus on that for a bit.
Okay, so alcohol use disorder would be when a person shows a pattern of consistent alcohol use, and to the point that it's causing dysfunction in their day-to-day lives, as well as eventually over time you would see changes in their physiology as well. So it's much more serious than, let's say, casual drinking. If we're sticking to those guidelines and it's not causing dysfunction in our day-to-day lives, then that's not considered alcohol use disorder.
Okay.
So it becomes a disorder where you're seeing really problems in their interpersonal relations, for example, problems with their work, family, friends, legal issues.
Okay.
So so they try to create a definition that captures where it becomes a problem in the person's life.
Okay.
And that surely does lead to also physical issues, and that's also part of the definition.
Part of it as well. So then what about binge drinking? What about a person who's able to go to work every day, hold down a job, take care of all of their responsibilities, but then they binge drink on the weekend? Would that be captured in that definition?
It would be if they're doing it on a regular basis, just because when you binge drink, you are more likely to get into the kind of trouble that causes that. But binge drinking itself isn't the diagnosis. So we actually use binge drinking as a way to assess risk. So one of the most common way that we screen is we check for binge drinking actually in the past year.
I see.
So if a patient has had one day of binge drinking, then that would we would define that as risky drinking.
Okay.
And so then that would lead us to screen for more serious alcohol use, and if it doesn't meet the criteria of alcohol use disorder, we would advise them that they should definitely cut down, because once you meet the definition of binge drinking, you are in danger of potentially having some issue.
Alcohol use disorder. Okay, I
Yeah,
got you.
yeah. Like for example, if you binge drink, sometimes people will drive, get in an accident, but it would be like a good way to screen that there is something more serious. Maybe not necessarily alcohol use disorder, but it would be risky drinking.
Behavior.
Yeah,
Yes, I got you. I understand. So let's talk specifically then about the treatment of alcohol use disorder. And specifically, let's talk about one of my favorite topics, which is medication-assisted therapy, because I have truly seen that change people's lives. And in my opinion, not enough people know about it, and even less people know about it in relationship to becoming free of alcohol, if that is a problem for them. So let's talk about medication-assisted therapy. Tell our listeners what it is and how it can be used in the treatment of alcohol use disorder.
Okay, so if somebody has a drinking issue that is serious enough to meet the definition of a disorder, we can offer medications that are FDA approved. There are also medicines that are not FDA approved, but the reason they're not is the evidence behind them is not strong. But the ones that have strong evidence, we have 3 medicines that are commonly used. One is disulfiram, another is naltrexone, and a third one is acamprosate. So these are the ones that the FDA feels are safe enough and that they have a benefit for use. But we would offer these medications, definitely we would take into account the patient's medical history, if it's safe for them to take the medicine, and then we would give them medication in association or in conjunction with counseling, intensive counseling.
Absolutely.
So that's the other part of it, is that we need to approach it from a multifaceted perspective and not just focus on one. And part of it also includes the patient's willingness as well. The medication can help people who are motivated, but its benefit for people who are just marginally motivated is modest.
Okay, absolutely. And of the medications that you mentioned, are one of those medications commonly known as Vivitrol?
Yes, so naltrexone is commonly known as Vivitrol when it's injected. So we have it available as an oral medication, and we have it available as an injectable, which is a pretty cool medicine in that the patient just comes once every 4 weeks and they get the injection. It's an intramuscular injection, and they're pretty good. They're basically good in terms of taking medicine for another 28 days. So,
in combination with counseling. And that's what we do at the Popoff Family Health Center, in combination with the work that you do with them.
Yes, and we also have dedicated counselors that are specialized in substance use disorder, and we also have our whole program is set up in terms of treating this issue. So I think we have a very good program.
Absolutely.
Currently.
I would agree. And I'm going to stop here and say, if you or someone you know have an issue with substance use disorder, or believe that you have an issue with substance use disorder, particularly alcohol, because that's what we're talking about today, I would love for you to call the Popoff Family Health Center at 313-824-1000 and push prompt number 1. And then just ask for the medication-assisted therapy program. You will then be referred to Dr. Saghir as well as the counselors. Again, that's the Popoff Family Health Center at 313-824-1000. Now, whenever I'm talking to anybody about recovery around alcohol, the first thing they say to me is, "Oh my God, Loretta, please don't talk to me about anti-abuse." You know, people who have had, you know, issues in the past, and they think whenever you talk about alcohol use and trying to recover from that you're going to talk to them about anti-abuse, and they have nightmare stories about they used some mouthwash and it had some alcohol in it and they got violently ill. We're way past that in our treatments of with people, right? There's things that don't involve anti-abuse, correct?
That's true. So anti-abuse is one of the FDA that I mentioned, FDA-approved medicines. It's you know, commonly known as disulfiram. But you know, we only give that medicine if a patient is motivated to take it, because it doesn't really help if they're not really invested in taking it. Yeah. So they've done studies and it shows that the patient isn't interested in taking the medicine, it doesn't really help very much.
Yes.
But there is a subpopulation that, you know, really wants to use that medicine specifically.
Right.
And it helps them, you know, they take the medicine either themselves or a family member gives it to them every day and they take it, and, you know, taking it does help them abstain.
Yeah.
So
but Vivitrol doesn't have that effect, does it?
No,
it doesn't have that anti-abuse effect.
Not at all. It's basically it does affect you when for the patients that I have drunk while taking anti-abuse. I mean, the Vivitrol. They do not get ill at all. They don't experience any of that. They do feel, some of them do describe maybe taking longer before they kind of feel something sometimes, but they haven't really described any nausea
but that's
with
a good
with
thing,
alcohol.
Right? It's a blocker. It causes them not to really get the reward benefit, right, of their drinking.
So the way that it works for patients with alcohol use disorder is it really decreases kind of their craving in a way. A lot of patients say that it kind of decreases their desire for alcohol.
And that's the beauty of it.
Yeah.
That's absolutely the beauty of it. Now, I know that we're running out of time, so I want to talk specifically about April the 7th, which is National Alcohol Screening Day, because I know that we're going to be screening at Popoff. And alcohol screening is an important tool that can help patients and the physician understand the extent to which patients are at risk for alcohol abuse. But from your perspective, I'd like you to just share with us, what should a physician consider if they're thinking about doing this kind of screening? When is it recommended? And maybe a few tips about how it can be done in a way where it's culturally sensitive, it's not offensive, and where it may trigger the least amount of pushback from a patient when you suggest maybe you should be screened for alcohol overuse.
Okay, yeah, that's a good question. The United States Preventive Task Force, they've studied this, and they feel there's a very good evidence that primary care doctors should screen. They recommend for the ages of 18 and older.
Okay.
And they found that screening for risky drinking, in conjunction with advice, which they call brief intervention, has a lot of evidence that it helps and it changes patients' drinking habits.
All right.
So we actually have almost 50 years of evidence that this approach works. And so generally you would screen. There are different ways of doing it, but one way that's very easy to integrate into practice would be just having one question about alcohol use.
Okay.
And I think we touched on that earlier. It's that if the patient has an incidence of binge drinking in the past year, then that would be risky drinking, and it would prompt you to investigate further. But if the patient does not have meet the criteria for alcohol use disorder, you can just offer advice not to surpass what we spoke about, the limits of drinking that we've spoken about. Sure. So you would say, I'm going to ask you a question which I ask all my patients.
Okay.
And the reason why I'm asking this is because it will help me treat you if you have an issue. So it's for your benefit, and asking this because we can treat these issues. You know, we have treatments for this issue, and so I don't want you to get offended. I ask all my patients this.
I think that's the key. I ask all my patients.
Yes, so because a lot of patients sometimes might feel like you're only asking them this because of something about them that, you know, they'll say to themselves, well, what is it about me that made you ask that? Is it the way I'm dressed or something? And it has nothing to do with that. That's why it's called screening. You know, we literally ask everybody.
Everyone.
Yes, and so
making no assumptions.
No assumption. No, it has nothing to do with the person's education or, you know, lifestyle or job. You know, this is just a screening questionnaire that we ask everyone so that we can capture, you know, try to capture as many people that have this issue as possible, and that way we can get them into treatment.
Absolutely.
So I think when patients know that it's not, you know, it's nothing about them, it's something we ask everyone, they really don't get offended.
And I think that's the key. I think you've nailed it. One last question. How often should it be done? Is it annually, or should you be asking it on each visit, or is it an annual thing?
Yes, so definitely it should be done annually at least. But if during the course of your interview with a patient, if you had already asked and during, you know, on a future visit, let's say they say something that, you know, relates, gives you a clue that maybe there is something going on, then definitely at the end of that visit, you should address, you know, basically screen again.
Yes.
And that way, because sometimes maybe the patient at that time either didn't have a problem or didn't think they had a problem, or they, for whatever reason, they answered in a way that wouldn't have captured that they have risky drinking. You might be able to, you know, get a positive response on that future visit, in which case you can, you know, do something about it, because we have so much evidence that it helps, just that advice.
Just the advice, asking the question and offering the advice.
Yes, but there is also a caveat with that, and that is that the advice has to be offered over multiple visits.
Okay.
So just one time isn't it, and it doesn't have to take long. It literally takes, you know, 5 minutes. You know, you just tell the patient honestly, you know, you are, you know, this level of drinking is risky, and we have evidence that it's risky. And so my advice to you is that we decrease it to these, you know, what is guidelines. You know, you shouldn't drink more than four drinks if you're a man, and don't drink more than 3 drinks if you're a woman in a single day.
Okay.
And then also include that within a week, not more than 14 drinks for a man and not more than 7 drinks for a woman.
Okay. Dr. Saghir, you have shared some very important information. Thank you so much for being my guest.
You're welcome.
I appreciate all that you have shared. Thank you. This is a very important topic. As always, knowledge is power, and we'll see you again next month.